Hi, I'm Dr. Lisa Erickson, and I'd like to talk with you about phase one of your rehab. For phase one, there are a few things that you need to do for yourself, and there's a few things that your doctor or your health care provider is going to do for you. Working as a team is very important so we can ensure that you heal as quickly as possible. Our first goal of phase one is locating the injury. We need to decide what exactly is occurring beneath the surface, and this usually begins with developing a working diagnosis of what we think is going on. With your rehab and with the results that you get to our therapies, then we can better understand whether we need to modify our current treatments or whether they're working perfectly. If we have any question or any issue, that is when we send you out for advanced imaging such as X-ray or an MRI or even a diagnostic ultrasound. Inflammation control is also important when we are beginning your phase one of rehab. Inflammation causes an injury to be more painful and also decreases our ability to control what's going on at a cellular level. This is why we recommend either kinesio tape to compress it or a compressive sleeve so we can better get your injury under control. Pain reduction is third in phase one of our goals for your rehab. We want to make the tissues pliable, we want to make them flexible, and this might create more pain, especially if we're rehabbing an area where atrophy or weakness exists. Our goals for actual tissue flexibility and joint motion include increased ranges of motion as well as increased mechanics of how that tissue works. If your pain is coming because of if your pain is created because of a cause of bad biomechanics or bad habits or postures, those are the number one goal we have during phase one, is to figure all those out and fix them so that our care can progress to phase two. Also, as we previously discussed, avoidance of bad dietary behaviors such as eating red tomatoes or red and green bell peppers or red meats will definitely help us to get your inflammation under control so we can rehab it and have the correct response and know whether we are pushing it too hard or whether your body is happy and able to accommodate our rehab and our therapy. Phase two is strength and endurance and conditioning and should not involve any inflammation control. At this point, your inflammation should be down, your tissues should be flexible, and we should have full range of motion of your joints. From there is when we start to tack on more balance, more proprioception, and to push you. From an athlete that has been injured and unable to use that region to slowly asking that region to be used in a way that does not provoke it in inflammation and also makes the region feel safe and not that it needs a spasm or be tight or be contracted. Also picking exercises that the region is able to do in a safe manner without recruiting nearby aid. So as an example, if we have sprained our ankle, the calf muscle, the gastrocnemius, and the soleus like to get involved and over-assist so that the smaller muscles of the ankle, the peroneals and posterior tibialis, as well as the little muscles of the foot, the calf wants to take over for these and not allow them to do their job. So we get this muscular imbalance and also this incorrect motor pattern recruitment, which we need to fix. And this is the major goal that I try to take care of during phase two. Phase three includes more functional improvements and additional improvements in power, explosion, and we start to do very sport-specific therapy. This is when we send you off and have you do a lot of this stuff on your own and then check in with us to ensure that you're making improvements. Only after phase three, where all of this in-office stuff has taken place, where we know in a controlled setting that your injury is safe from being re-injured, can we send you out and give you the okay to do whatever you want to do, which is where phase four starts. So hope that helps. It's just a whole understanding of the different phases and what they involve.